Hi, Hunty. There's a brand new surgery operation in Maple Hospital called appendicitis. I'm going to show you everything you need to know about it. Let's go, Hunty. First, I'm going to show you how to get an appendicitis patient. Of course, you can go to the pre-op room and there's several patients laying around ready for surgery, but I know a lot of y'all are wondering, how do you know who has the tumor and who has appendicitis? If you go to any computer, you can see their symptoms. The symptoms for appendicitis is sharp and constant abdominal pain on lower left side, fever, nausea, vomiting. So if you see any of these symptoms on the patient, they are the appendicitis patient, which is going to be Jose. Now you can walk up to them and press start surgery, or if you're in the computer already, you can just press them and it'll ask you, would you like to be Jose T's surgeon? And you can say yes or you can say no. I'm going to say no right now because we have our handy dandy helper patient here, Z-Long. Hi, Z-Log. Hi. So y'all can see Z-Log here is a real player. So I'm going to show on him process from beginning to end for appendicitis. He already has the symptom here. Who is that throwing up? And if you're wondering how he got the symptom, he went to the right-hand side, pressed status, and then he selected appendicitis. And so I'm going to check him in like normal. Sir, why he keep throwing up? Yo, stomach hurt. Oh my gosh. Stomach hurting. Are you sure you just don't have to toot it up? And now it says to take him to an ER room. Let me spit some fun facts. So, appendicitis is when your appendix turns bad. And your appendix is the thing that holds all your good stomach bacteria that help your stomach fight off germs. So, let's say you got diarrhea and you be tooting it up, toot toot. Your appendix is the helper organ that fights off all the diarrhea germs. It's part of your immune system. What's your heart rate? 120/80. Perfect. Perfect. I'm going to go onto the computer. Look, he has the same symptoms as that appendicitis NPC we saw up there. Sharp and constant abdominal pain on lower left side, fever, nausea, vomiting. So let me just do all the regular check-in things. Got to give him his gown so he's nice and comfortable. And then the doctor has ordered treatments. He's still under an NPO, no eating or drinking, but we're going to pump antibiotics IV. Whereas with the tumor, I think we pumped a saline IV. So that's one of the differences. Bruh, did I pick saline? I meant antibiotics, the yellow one. Raise head of bed using bed controls. Oh, so if you go to the corner of the bed, you can incline. Wow. Are you comfortable? I'm gonna give you a cold compress. So I'm just gonna go to my tools and type in cold compress. And this is what it looks like. I'm guessing he's feeling a little warm because his appendix is bad. He also needs anti-medic per the doctor's instructions. I'm gonna walk over to Quixie's med station. Here's the anti-medic. It looks like a general pill bottle, but it's gonna help his nausea and vomiting. Here you go, Hunty. And we need to get a better look at his appendix. So we're going to bring him over to the CT scan room. I went to tools, I got a bed, and now I'm going to put him in said bed. Why look like he holding something? Ciao. The CT room is on the first floor. Past the ultrasound, it's room 106. So if you know where room 4 is, where labor and delivery is, it's along this wall and it's room 106. Chow, how do I get him? I'm on the thing, Chow. Oh, Lord. D-Log, I'm sorry. Get on the thing. Oh, Lord. Okay, perfect. He is finally on the CT scan thing. And we need to insert the bed. If you go close to the machine, there's this button here that says insert bed. Press that, and there he goes. There he goes. Oh, oh, oh. Exit this room, and now we are in the control room. Just like the MRI, there's gonna be this little panel here. Press start scan. Oh, it sounds like it's about to blow up. And now we need to remove him from the bed. So go back to the machine and press remove bed. We are headed back to the ER. Z-Log, are you okay? You're kind of quiet. You good, bro? You're okay? All right. Blood, it's time to take your blood. I need some gloves. Y'all, the weather is really bad over here, and my arm is missing. Now that I have the blood, I will be putting it in the capsule machine. There goes the sample. It's going to be sent over to pharmacy for them to do their diagnosis on it. We're going to throw away these funky gloves, and then we shall wash our hands in the sink. The lab has received your sample and will have the results shortly. From Dr. Brooks, Z-Log's lab results are in. It is time for surgery, but first, we definitely need our patient's consent. Go over to the printer and print the consent form. Give surgery consent form to patient. Here you go, Z-Log. Sign away your soul, and then I will file it in this box. Nice. So that's the set of tasks that the nurse will complete in order to get your patient submitted to pre-op. Now, as a surgeon, I am going to start surgery on Z-Log. And you don't have to do this, but personally, I am going to bring Z-Log up to the pre-op room. I just feel like that's the appropriate and the realistic thing to do. If he's sick, why would I have him walk all the way there by himself, chill? Okay, I'm gonna put you in this bed. Nice. So on the second floor is the surgery area, and we are going to scrub in here at the sink. And then I'm gonna be in operation room 1. We are going to dry off our hands and then throw the towel into the trash can. And then over in the corner in here, we're gonna put on our surgical gown and a mask. And this is all just to keep things sanitary. Same thing with the gloves. This is the beauty, the surgical bed where all the surgery magic will take place. I need to get Z-Log some clean sheets, so I'm gonna open this cabinet, and I like to type in the item, so I'm typing in sheets and then placing it on the surgical bed. There is a little bit of lag from when I press the button to when the sheets actually show up, so just be patient for a second. And here's Z-Log. Wait for Jasmine to attach the IV. Turn on surgical light. I think that's the secondary light. Nice. So Jasmine has everything prepared. She has the surgical mask, everything. Some of y'all asked me if you can get rid of the surgical nurse. You cannot. It's just part of the surgery workflow right now. So you have to have the surgical nurse. Let's get started. Hi, Z-Log. I'm Renee. I'll be your surgeon. I graduated from Timu Medical. And don't worry, you're just gonna get a little sleepy here while I put in this sedative. You are getting sleepy. And now I'm gonna push some saline. Here's the saline flush. Pushing saline, pushing saline. Go to sleep, go to sleep, go to sleep, little Z-Log. Nice. Now we need to prepare the surgical area. Go back to the surgery cabinet and get the betadine bowl, the betadine solution, and I believe you'll also need the sponge forceps. And then walk over to this silver tray, place the bowl, fill the betadine bowl with the betadine bottle, and then the sponge forceps, soak them in the betadine. We're gonna use this to clean Z-Log's skin, him dirty. And now that we have the scalpel, I don't think I should be trusted with the scalpel. I'm gonna make an incision. Oop, I'm kind of messing up a little bit. The accuracy percentage is brand new. If you aren't good at surgery and your accuracy gets too low, your patient can go into code blue. So be careful, y'all. And then now we need to open the fat layer. I want Z-Log to code, so I'm being the worst surgeon possible. I don't think I'm doing a very good job. Hold again to catheterize the blood vessels. This stops the bleeding. And now we're gonna open the muscular layer. Hold again to get the blood vessels. And now we are clamping the base. We are applying a second clamp. And finally, we are using scissors to cut out the appendix. Which way do you go though? There we go. And then we have to drag the appendix to the specimen container. And now we are going to stop the blood vessels from bleeding again just by holding down and suturing. We're suturing. I love how you can actually see the needle in some of it. And now he's on his way to post-op. Time for recovery. Go Z-Log, go Z-Log, go. Go Z-Log, go Z-Log, go. Throw away your gloves and your mask. Here's a trash can over here. Chill. And then let me go back to the surgery room and grab the container. I always like to follow my patients out of the room. And then we are going to send it up the tube system. Grab here, grab here. Log the surgery. He did have appendicitis surgery. Surgery completed. I earned 41 XP. And it looks like Z-Log is still here. Why weren't you in that bed? He's still here and he's still alive. Yes. Honestly, there weren't a lot of differences between this surgery and the tumor surgery. You still had to cauterize the blood vessels, cut through multiple layers of skin and fat, and remove the appendix. But you know what? I don't mind it. I love that we're doing surgeries. I love that the patient's symptoms are different and the use of different machines during their diagnosis. And I'm just really happy I can finally be a surgeon in Maple. Down in the comments below, let me know what you think about the surgery. Apparently, your patient can have a code blue if you aren't very good at performing surgery. So just be prepared to help them whenever they code, child. Really, if you're doing your job how you're supposed to, they aren't going to. So just be a good surgeon. I'll see y'all next time. Bye, y'all.